Hello, this is Dr. Morris. I'm going to do a review for the cardiac lecture exam. This is exam 1 for A&P2. See, let's go ahead and start with some of the layers of the heart, starting with the visceral layer of the pericardium. Should be able to recognize and know what the visceral layer of the pericardium are. And actually, you should know what the endocardium, the epicardium, and the myocardium are, where they're located at. That's epicardium, pericardium, myocardium, and the endocardium. So, 4 terms there that you should be familiar with. Structurally, you should know where they're located at, and you should know a simple description of each of those layers: epicardium, pericardium, myocardium, and endocardium. You should know the general function and structure of the left ventricle. General structure and function of the left ventricle. You should be familiar with the general function and structure of the right ventricle. You should know what's meant by the right atrioventricular valve. There's another name for that valve. You should know where it's located at, what its primary role and function is. You should know anatomically where the aortic valve is located at, general characteristics of the aortic valve. Should know where the mitral valve is located at, the general characteristics of the mitral valve. Should know where the bicuspid valve is located at, the general characteristics of the bicuspid valve. And the tricuspid valves, you should know where they're located at and the general functions of the tricuspid valves. You should be able to follow circulation through the heart, bringing blood into the heart, deoxygenated blood from the system. What vessel brings it from the superior portion of the body, what vessel brings it from the inferior portion of the body. As it enters into the right atrium of the heart, you should be able to take blood completely through the heart and out of the aorta. You need to know where the semilunar valves are located at. You need to know the alternative names for both of the atrioventricular valves. The left atrioventricular valve has 2 other names. The right AV valve has another name. You should remain focused on the structures of the heart, and again the circulation, being able to take blood into the heart and taking it out of the heart. There's a second question here that involves that, being able to trace blood coming into the heart, again into the right atrium, and tracing it out of the heart through the aorta. So make sure you know how to trace blood through the heart. You need to be familiar with 2 structures in fetal anatomy. One is called the ductus venosus, and the other one is called the foramen ovale. You should know where the foramen ovale is located at. You should know its purpose. You should know what the ductus arteriosus is and its purpose. As an adult, these 2 structures change names, but they do have remnants that are left in the adult system. You should know their names in the adult system and what their function is. Need to know where the tricuspid valve is located at and what's its function. Need to know where the bicuspid valve is located at and what its function is. You should be able to tell me the layers of the heart, beginning at the deepest point with the going to the most superficial part. And remember, those layers of the heart include epicardium, myocardium, pericardium, but you'll have to put them in the correct order, knowing which one is the deepest layer and which one is the most superficial layer. You need to know what's meant by backflow of blood, and obviously the heart valves prevent the backflow of blood. You should be familiar with what that term means. You should be familiar with the definition of ischemia. You do need to know what the role and the purpose of the right ventricle is. Where does blood go to from the right ventricle? The same with the left ventricle. You need to know what chordae tendineae are. You need to know the role of the pulmonary arteries and what type of blood is taken away from the heart, whether it's oxygenated or deoxygenated blood. You need to know the primary role of the atriums, what their role is. Let's see, you'll also need to know what the definition for ischemia. I think I may have already said that. I'm sorry, I'm being redundant here. You do need to know where the structure of the chordae tendineae are located at, why they're important. You do need to know in the circulation of the heart what vessels carry oxygenated blood, what vessels carry deoxygenated blood. You need to be familiar with the conduction system of the heart. I showed an illustration on the PowerPoint presentation for the cardiac lab demonstrating the SA node, the AV node, the bundle of His and the Purkinje fibers. So you do need to know the sequence by which the heart beats, knowing that the atriums contract first. There's electrical activity seen on an EKG that demonstrates the atrial contraction or atrial depolarization. You need to be familiar with that. There is also a finding on the EKG that demonstrates ventricular contraction. You need to be familiar with that waveform. That's the QRS pattern. And then ventricular repolarization is seen by the T wave on the EKG. You need to be familiar with that. You do need to be familiar with the valvular system of the heart. Remember, there are two atrial ventricular valves. On the right side of the heart, it's referred to as the tricuspid valve. On the left side, it's referred to as the bicuspid or the mitral valve. You do need to know the importance of these valves. They separate two chambers of the heart, atriums from the ventricle. You need to know what happens to blood when it passes from one chamber to the other, and the importance of the heart valves, why they prevent regurgitation of blood. You do need to know the rate of the heart rate as it relates to the SA node. How fast does the SA node beat and fire? You need to know the rate of the AV node and how fast that node fires. Again, you need to know the term ventricular depolarization and what that is. Where do you see that at on the EKG? You need to know what occurs in the heart in the influence of sympathetic stimulation and parasympathetic stimulation. You do need to know the effects of an increase in heart rate, the term cardiac output, the term atrial blood volume, and the term blood pressure, and how an increased heart rate affects each of those parameters. You need to know the definition of cardiac output. Let's see. You need to know what's meant by the pulmonary circuit and what's meant by the systemic circuit. You need to know the anatomical location of the heart in the thoracic cavity. You need to know the structures of the atrium, particularly the right atrium. You need to know what the fossa ovale is representative of. You need to know what the auricle is representative of. You need to know where the moderator band is located at and its function. let's see. You need to be able to follow the conduction pattern of the heart. The conduction pattern, what I mean by that, the firing of the nodes starting at the SA node and completing with the Purkinje fibers. So you need to follow the conduction pattern of the heart. And you need to know what is meant by stroke volume and cardiac output, and some influences that affect stroke volume and cardiac output. And that ends the review for the first exam. Good luck in your studying.